Hi, Smizzy.
Hi.
My name's Steve. I'll be your nurse practitioner today. Can you tell me your date of birth?
Yes, February 22nd, 1960.
Okay, and what gender do you identify as?
Male.
And how may I address you today?
Mike is fine.
Okay. All right, Mike. Well, we're going to start your assessments. What brings you in to see us today?
I'm new to the practice, just getting my physical.
Okay. If you did have a symptom or pain, I would address it using the mnemonic OLD-CARTS, which stands for onset, location, duration, characteristics, aggravating factors, relieving factors, temporal factors, and severity. And then we discuss any pharmacologic or non-pharmacologic treatments you're using. Okay. Just going to ask you some questions about your medical history. Do you have any chronic medical problems?
Yes, I have high blood pressure and reflux.
Okay. Have you ever been hospitalized or had surgery?
I had a hernia repair twice.
Okay. Have you ever been hospitalized or taken medication for mental health issues?
No.
Okay. Are you up to date on your immunizations?
Yep, got my flu shot.
Okay, great. Do you have any allergies, which would be seasonal, environmental, or medications?
No.
Okay. Do you take any medications on a daily basis?
Yes, I take two medicines. First one's Micardis, 80 milligrams a day for my blood pressure, and Nexium, 20 milligrams once a day for reflux.
Okay. And how about any supplemental or vitamins?
I'll take a chewable calcium once a day.
Okay. And for your personal history, who do you live with?
My wife, I'm married.
Okay, so you're married. All right. And what do you do for an occupation?
I'm a physician.
Okay. And do you feel like that provides for your economic needs?
Yes.
Okay. Are you exposed to any toxins at work or at home?
No.
And do you feel like your relationships are supportive?
Mm-hmm.
Okay.
Yep.
All right. For your spiritual history, I'm going to use an assessment tool called FICA. So do you have a faith that you associate with?
Protestant.
Okay. And how important is that to you dealing with stress and things in your life?
Very important.
Okay. And do you have a faith community associated with this?
Yes, I attend Dayton Avenue Baptist Church.
Okay. And is there anything I can do to address spiritual needs or anything that may affect the care that we give to you?
No, I'm grounded in my faith and it guides everything.
Okay, great. For your personal history, how often do you use tobacco products?
I don't.
Okay. How often do you drink alcohol?
I don't.
How often do you use illicit or street drugs?
Never.
Okay. And how often do you exercise, and what kind of activity do you do?
Well, I get at least one, sometimes two long walks every day, pretty much.
And how often do you eat a well-rounded diet with things like fruits and vegetables?
Every day.
Okay, great. For just some health habits, do you go to the doctor often, or when was the last time you had a physical exam?
Physical this summer.
This summer, okay. Have you had any diagnostic tests like lab work, CT, or X-ray recently?
I had in August, I had blood work and I had a shoulder X-ray.
Okay. And do you do any kind of exams at home, like testicular or breast exams?
Yeah, probably about once a month in the shower.
Once a month is perfect. Okay. And for your family history, this will include your parents, your grandparents on either side, and your siblings. Any history of diabetes?
Yes, I have an aunt, a brother, and a son.
Okay.
With diabetes.
How about high blood pressure or heart disease?
Both in my mom's mom, so my maternal grandmother and my mother.
Okay. Any strokes?
No.
Any history of liver or kidney issues?
No.
No. Okay. And how about any genetic or congenital disorders?
No.
And do your children have any congenital disorders?
No.
Okay. All right. I'm just going to ask you a series of questions, kind of working from head to toe about your health. Any fever, chills, weakness, malaise?
No.
No. Okay. Have you noticed any night sweats or weight loss recently?
No.
Do you feel like you have a good appetite?
Mm-hmm.
Okay. Any problems with your weight, losing, gaining, or are you at about a desired weight?
Close to where I want to be.
Okay. In terms of your bruising, have you noticed any excessive bruising on your skin, or noticed you bruise easily?
No.
Okay. Any history of anemia?
No.
Have you had any changes in your neck, hand, or foot size?
No.
How about your hat size?
No.
Okay. And do you notice you're intolerant to heat or cold? Can't stand to be in the heat or cold?
No.
Okay. For your head, have you had any dizziness, headaches?
No, I get headaches fairly often, but just mild tension headaches.
Okay. Any loss of consciousness in the past?
No.
Okay. Any confusion or loss of coordination?
No.
Okay. Do you have any problems remembering things?
No.
Any issues with mood changes or mood swings or insomnia, difficulty sleeping?
No. wake up sometimes, but
Okay.
no,
In the last 2 weeks, have you had any loss of interest in doing normal things?
no,
In the last 2 weeks, have you felt depressed at all?
no,
Okay. And in the last 2 weeks, have you had any thoughts of suicide or homicide?
no,
And then starting with your eyes, have you had any blurry vision, double vision, loss of vision?
no, just my glasses.
Okay. Any history of trauma to the eye?
No,
Any pain or discharge from your eyes?
no,
With your ears, any pain,
no.
ringing in your ears, vertigo, which is like the room spinning
Oh, my ears do ring. They're ringing now, all the time.
all the time? Okay.
Mom,
Any discharge from your ears?
nope,
Okay. And with your mouth, do you have any sores, any broken teeth?
no,
No. Any pain in your mouth?
no,
No. Okay. With your neck, any difficulty swallowing?
no,
Have you noticed any hoarseness, cough, sore throat?
no,
No. Okay. With your chest, have you had any coughing or coughing up phlegm?
no,
Any night sweats?
no,
Exposure to tuberculosis in the past?
no,
Any shortness of breath or shortness of breath when you're exercising?
no,
With your nose, have you had any nosebleeds or anything running down the back of your throat?
no,
Okay. And any long-term congestion?
no,
Okay. With your heart, have you had any palpitations or it's beating fast or any chest pain?
no,
Do you have to sleep with more than one pillow at night to breathe okay?
no,
How about your calves? Do you have any pain when you walk long distances?
no,
Okay. With your abdomen, any nausea, vomiting, diarrhea, pain?
no,
Any change in bowel or bladder habits?
No.
Peeing more? No. With your urine, have you been going more frequently than normal, having urgency or hesitancy?
Mhm.
Any
No.
burning when you urinate or any blood in your urine?
no.
Okay. And how many sexual partners do you have?
I do get up at night a couple times and go, but other than that, it's okay.
Okay. Okay. How many sexual partners do you have?
Just my wife?
Okay. And any concerns about that you want to address at today's appointment?
No,
All right, great. So now I'm just going to start with our, sorry, I forgot to ask you about your joints, your knees and your ankles and your elbows and your wrist. Any heat or inflammation that you've noticed?
no, they just crack a lot.
Okay. All right. All right, well, great. We'll start with our physical exam. Just going to wash my hands here real quick. Okay. And I'm just going to start with your skin. So I'm going to feel right here. Skin is warm and dry. Skin turgor is rapid, less than 1 second. I don't see any eruptions, changes in coloration, or abnormal moles on the exposed skin. Next, for your cranial nerves. Cranial nerve 1 is the olfactory nerve, so I would test that using sense only if it was indicated with abnormalities in the other cranial nerves. For cranial nerve 2, which is the optic nerve, I'm going to have you go ahead and, with your glasses on, cover one eye and read the smallest line possible.
That's 374258.
Okay, and then with the other eye, go ahead and read that same line backwards, or if you can read a smaller line.
852473.
Okay, perfect, and that is 2030. Next, I'm just going to have you look at my finger right here. I'm going to go like this and let me know when you can see it, okay?
Okay. Now?
Okay.
Now? Now?
Same thing on the other side.
Now?
Okay.
Now?
Good.
Now?
And for optic nerve 3, or cranial nerve 3, the oculomotor, cranial nerve 4, the trochlear, and 6, the abducens. I'm going to have you watch my finger. Don't move your neck at all. Just follow it with your eyes. Okay. Okay. Good. Moving through the visual fields is normal without any nystagmus noted. For cranial nerve 5, which is the trigeminal nerve, I'm just going to test your strength in your jaw, so go ahead and bite down for me. Okay, and then open your mouth. Okay, and close it again. Good. Equal strength bilaterally, no TMJ was noted. And then I'm also going to test your sensation. So this is soft. This is sharp. I'm going to have you close your eyes and tell me if you feel soft or sharp.
Soft. Sharp. Soft. Soft. Sharp. Sharp.
And can you feel me touching on both sides?
Mm-hmm.
Okay, good. You can open your eyes, or sorry, keep your eyes closed. I'm going to do the same thing on your arms here. Tell me soft or sharp.
Soft. Sharp. Sharp. Soft.
and on your legs as well.
Soft. Sharp. Sharp. Soft.
Okay, great. Sensation intact. I'm going to do the same thing. This is going to feel like vibration. I'm going to have you close your eyes and let me know if you feel it.
Yep. 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 Yes. Yes.
Okay, great. And for cranial nerve 7, your facial nerve, I'm going to have you go through a series of expressions. So raise your eyebrows up, close your eyes as tight as you can. Good. And then smile with your mouth open, smile with your mouth closed, purse your lips for me, and you can open your eyes, and then puff your cheeks out. Good. For cranial nerve 12, the hypoglossal, I'm going to have you stick your tongue straight out and touch the roof of your mouth, touch the bottom of your mouth, touch the left side and the right side. Excellent. And all are intact, no deficits, none on either side. For cranial nerve 8, which is the acoustic nerve, I'm going to have you let me know when you hear this sound, okay?
Okay. Now.
Okay, same on the other side?
Now.
Okay, good. Then I'm going to perform something we call the Weber test. So I'm going to place this on the top of your head. Let me know if you hear it equally on both sides or the same, or stronger on one side than the other.
Okay.
Okay.
Same.
Okay. And then for the Rina test, I'm going to place this just behind your ear. Let me know when it stops. And then right in front of your ear, let me know when you stop hearing it. Okay.
Stop.
Okay. And let me know when it stops.
Stop.
Okay. Air conduction is twice as long as bone conduction. Same on this side.
Stop.
Okay. And let me know when it stops.
Stop.
Okay. And air conduction is twice as long as bone conduction. So those are normal results. Okay. For cranial nerve 9, the glossopharyngeal, and 10, the vagus nerve, I'm going to have you open your mouth up wide for me. And I'm going to just examine here. Okay, perfect. And right there, say ah. Good. And the uvula is midline and raises midline. And the soft palate also raises midline. No abnormalities there. We would elicit the gag reflex only if that was indicated with abnormalities. Okay. And then I'm going to have you just go through some fine motor movements for me. So just go like this as fast as you can. Touch each finger to your thumb. Perfect. Fine motor movements intact. And then take your heel and run it up and down your shin on each side. Excellent. And then for cranial nerve 11, which is the spinal accessory, I'm going to have you raise your shoulders against me. Good. Turn your head against my hand and turn your head against my hand. Perfect. And as intact, strength is equal bilaterally. Next, I'm going to test your reflexes. So for this one, I'm just going to have you relax your arm. I will move it around for you. So for the triceps, good. And then your biceps, just relax your arm like this. Good. Radiobrachial. Good. Patellar. Okay. And then the Achilles. Good. And on this side, triceps. Good. The biceps. Good. Radiobrachial. Good. And the patellar. The Achilles. Good. And all are 2+. And then go ahead and stand up for me. Maybe shift over here to the middle. I'm going to place your arms straight out like this, and then alternate touching your nose. Good. And then go ahead and flex your biceps on each side, alternating. Good. Okay, perfect. Place your arms like this, and then down. Hold them straight out in front of you, and then the other way. Good. Make a fist, and stretch your fingers out. Good. Arms intact. This next one, I'm going to do what we call the Romberg test. So stand with your feet together.
Okay.
Close your eyes. I'm going to give you a slight nudge and make sure you can maintain your balance. Good. Romberg test is negative. And then go ahead and stand over here for me. You open your eyes. Good. And then I'm going to have you walk heel to toe like this.
Okay.
Just come straight up to the front of the bed. Good. Coordination is intact. And then go ahead and walk back with a normal gait. Good. Steady gait. Noted. And then come right here, face towards the wall over here.
Okay.
Then I'm going to have you lean back while I support your back. Good. And then go ahead and reach down and try to touch your toes and assess your spinal alignment. Okay, spine is midline. No step off is noted. Go ahead and stand straight up for me. Shoulders are even on each side. And then I'm going to have you come back over here and go ahead and squat down like this. And then walk like a catcher a couple times. Perfect. Okay, great. All right, and then let me have you take a seat for me. Okay, so I'm just going to go ahead and feel your head. Normal hair pattern is noted. Okay, and no nodules are noted. Have you noticed any eruptions on your skin, like sores or anything like that? Any changes in color? Abnormals? And none are noted. And then I'm going to press on your frontal sinus here. Any pressure or pain?
No.
Any maxillary sinus? Any pressure or pain?
No.
Okay. I'm going to have you go ahead and remove your glasses. We're just going to go ahead and examine your eyes. So just go ahead and look straight up above my shoulder here. And I'm just going to shine this in your eyes. Don't look at the light right now. Okay, pupils are reacted bilaterally. Red light reflex is present. Okay, the optic disc is noted. It's round, creamy, even borders, no AV nicking is noted. Okay, same thing on this side, just don't look at the light right now. Red light reflex is present. Optic disc is noted. It's creamy with even borders. And there's no AV nicking noted. Okay, and then I'm going to examine your ears next. Do you have any pain when I touch your ears?
No.
Okay. I'm going to pull them up and back and examine here. Okay, the malleus, the elbow, and the cone of light are all noted. The TM is round and non-bulging, and no inflammation is noted in the ear canal. And the malleus and elbow and cone of light are all visible. TM is round, non-bulging, and no inflammation noted in the ear canals. Next, I'm going to check out your nose here. Okay, the inferior turbinates are noted. They're pink, non-inflamed. Septum is midline. And the inferior turbinates are noted. They're pink, non-inflamed. And the septum is midline. No abnormalities noted there. For your mouth, I'm going to have you open up wide again. I'm just going to take a look around. Okay, no sores noted. Tonsils are 2+. No broken teeth. Lift up your tongue for me. Good. And vasculature is noted on the tongue and is non-inflamed. Okay, I'm just going to feel your neck here. Okay, we're going to go through your lymph nodes. With the occipital, postauricular, preauricular, the parotid, submandibular, submental, posterior cervical chain, anterior cervical chain. Then I'm going to Feel these supraclavicular. Any pain in any of these areas?
Nope.
Okay, no pain or tenderness noted. Examine your trachea. Trachea is midline. For your thyroid, I'm going to have you just get a little bit of water in your mouth for me and hold it there. Okay. And I'm just going to go ahead and feel right here. Go ahead and swallow for me. Okay. And we're going to do the same thing for the other side. Thank you. Okay, go ahead and swallow for me. Okay, good. No nodules or inflammation are noted on the thyroid bilaterally. For your chest, I'm just going to have you turn this way for me. Perfect. Good. And I'm just going to tap on your chest several times. Go ahead and take some deep breaths for me. Okay, excellent. And go ahead and turn towards me. Place your arms like this. Okay, I'm just going to tap again. Resonance was heard throughout on the posterior fields. Okay, and resonance heard throughout. Take some deep breaths again for me. I'm going to do the same thing on the fronts. Okay, great. And some more deep breaths for me. Okay, great. And breathing is even and unlabored. I'm just going to have you turn this way just a little bit. Just going to feel here for your PMI. It's felt at the fifth intercostal space and midclavicular line. Okay. Then I'm going to feel your carotid pulses. Okay, your radial pulses. Okay. Lift your legs up just a little bit. There we go. Dorsalis pedis. Or posterior tibial. And the dorsalis pedis. Good. And excellent. Alright, thank you. And I'm going to auscultate for carotid bruits. None heard on the left. Go ahead and take a deep breath in and hold. None heard on the right. Okay. Auscultate here at aortic, pulmonic, Erb's point, tricuspid, and bicuspid. I'm going to do the same with the bell. S1 and S2 were auscultated in all fields. No grubs, clicks, murmurs, or any extra heart sounds were auscultated there. Now I'm going to have you go ahead and lay down for me. And just raise your shirt up to about this level right here. Just going to inspect your abdomen. there's no bulging, no hernias noted, and no discoloration, no pulsations. Go ahead and raise your head up towards your abdomen for me. Good, and still no bulges or hernias noted. I'm going to do some auscultation, so you just lay back. I'm just going to listen in each quadrant. Should be hearing clicks at 5 to 35 times per minute. And vowel sounds are active in all quadrants. I'm going to listen for some bruise here of the aorta, the renal arteries, the iliac arteries, and the femoral arteries. And no bruise are auscultated. I'm just going to push on your abdomen lightly. Let me know if there's any pain.
Nope.
Okay. No nodules or tenderness noted on light palpation. And the umbilical ring. The epigastric area. I'm going to do a little deeper palpation, okay? Let me know if there's any pain. Any pain there?
No.
Okay. Okay. And then I'm going to palpate for your liver here. So I'm going to slip my hand right behind your back. I'm going to be pressing in. I'll have you take a deep breath and I'm going to press a little harder, okay? Okay, and breathe out. Good. And for your gallbladder, same thing. Okay, liver and gallbladder are now palpated. For your spleen, do the same thing here. And take a deep breath. Okay, and out. And for your left kidney. Okay. Kidney and spleen borders are not felt. And same thing here. Go ahead and take a deep breath. Okay, and out. Your right kidney is not palpated either. Any pain right here over the bladder? No. Okay. Okay. And then I'm going to have you sit up for me. I'm just going to tap on your back. Let me know if there's any pain. Okay.
Mm-hmm.
Pain there?
No.
Okay. And any pain here?
No.
Okay. No CVA tenderness, no bilaterally. So that concludes our exam today. Do you have any questions for me or any questions about any of the results?
No. That was thorough.
Okay. Well, it was good meeting you today, and hopefully we'll see you back here soon.
Okay.
All right,
Thank you.
Thank you. And this is the spiritual assessment I used, FICA.